East Africa today, changing lifestyles, a faster pace, and with it, an invisible danger. Rates of cancer, heart and other non-communicable diseases are increasing at an alarming rate, reaching epidemic levels in a decade if left unchecked. These diseases are now affecting the younger, working-age population. The reason?
We're not living the same like we did before. We're eating different foods, doing different types of work. The environment has changed tremendously. We now breathe in fumes that we never breathed in before. All these things must have some effect on the metabolism in the human bodies.
Sub-Saharan Africa bears a disproportionate percentage of the world's diseases, and expenditure on health is negligible.
For all of us, the medical frontier represents a compelling priority. The fact that Sub-Saharan Africa, with 11% of the world's population, bears 24% of the global burden of disease. And yet, Sub-Saharan Africa presently accounts for only 1% of global health expenditures. A global travesty indeed.
In Kenya, the figures are already ringing alarm bells.
There is no doubt that cardiovascular diseases and cancers are increasingly becoming a big health challenge. About 50 Kenyans die daily from various forms of cancers, while about 82,000 cases are diagnosed each year.
Beyond the statistics lies the human face of cancer. Dorkas Njeri Njuguna works as a pharmacist at the AKUH University Hospital in Nairobi. After a routine checkup 5 years ago, she got the news women everywhere dread: breast cancer.
When I got the results that I had cancer, as usual, cancer is a very devastating news. So I went into this depression mode. I was confused. I didn't know what to expect. You have these uncertain feelings. You don't know whether you're going to die. I thought it's a death sentence. I had never met anybody who had survived through cancer.
Then came more bad news. Dorkas would have to go abroad for some of her treatment. She needed chemotherapy and radiation therapy.
That meant I do my chemotherapy here, then travel to Aga Khan, Karachi, because that kind of treatment, the kind of radiation that he needed to conserve my breast was not available in Kenya.
Following her treatment, Dorkas is now in remission. Today, patients like Dorkas can get radiation treatment at home. The Aga Khan University Hospital in Nairobi has invested $50 million in a new heart and cancer center. The center was inaugurated on 25th July by Kenyan President Mwai Kibaki in the presence of His Highness the Aga Khan. With some of the most sophisticated technology in sub-Saharan Africa, the Heart and Cancer Center aims to be at the forefront of cutting-edge research and academic excellence.
As a university, we are focused on providing a quality education that is comparable to any other in the West or in other parts of the world. That for us is the goal. And everything we do is focused on doing that. That means a number of things. One is we focus on quality over quantity. We will be a small institution in numbers of students, but what we teach will be of the highest quality. Secondly, we want to focus on the problems of the regions where we work. So for example, the Heart and Cancer Center in Nairobi will focus on cardiac diseases and cancers that are prevalent in Africa, in East Africa, which are very different from those in other parts of the world.
The new equipment includes linear accelerators, or LINACs, some of the most sophisticated machines available in sub-Saharan Africa. The equipment is so precise that radiation can be targeted to the affected cells and not the surrounding organs.
Our intention now is to try and spare organs that would otherwise impact the quality of life. As an example, in a head and neck cancer patient, where traditionally the salivary glands were always sacrificed, we're now able to limit the dose so that the glands can continue to function and the patient is not left with a permanently dry mouth. This is just one example of how new technology is helping us to maintain quality of life for patients.
We are finally arriving at a point where oncology and cardiology in East Africa are no longer served with outdated equipment and proficiencies.
Recognizing the importance of research in providing quality health care, the new center will provide a context for superior medical education.
Let us put behind us the day when young Africans thought they had to go to other parts of the world for quality medical education, and then too often they stayed abroad. Similarly, let the day also pass when African patients think they must go to other parts of the world to find quality medical care.
The new technology needs experts, not easily available in East Africa. Early planning meant people were sent out to the Aga Khan University in Karachi 3 years ago to train as radiation therapy technologists. Others are being sent abroad to South Africa and Canada to special cardiology centers. East African specialists abroad like Dr. Harun Otieno have been persuaded to return and make an impact at home.
It almost is painful to see our patients or our people or your community suffering from conditions that can easily be treated, and you know that there's something that can be done to prevent this and also provide adequate care for them. I think people probably make the biggest change and biggest effect in terms of improving patients' outcomes or even providing care. Care has to be compassionate. It's not just machines, it's not just buildings, it's actually a culture of compassion and providing this care close to home.
After being wrongly diagnosed with gastritis in his hometown of Eldoret, Kenya, Ayub Ali came to the Aga Khan University Hospital in Nairobi for a second opinion. They found 2 blocked arteries. He was one of the first patients able to have his double bypass surgery at the center rather than having to go abroad, a relief for his family.
We would incur into a lot of expenses like traveling, where to stay, and not all of us would have gone with him. It would be only maybe me or my mom who would have escorted him, and that would be a bit difficult.
With the high level of investment in people and equipment, the cost of quality care is of concern.
This is why the Arkan program and the Arkan University Hospital, through its patient welfare activities, will provide an average subsidy of 50% to those patients who are unable to afford their care. But in the longer run, we will also need an imaginative combination of cost redistributions, endowment funding, credit and insurance offerings, and other innovative financial products. I hope that creative financial institutions will join the medical sector in addressing this difficult challenge.
One such example is the partnership with the Agence Française de Développement.
France and the Aga Khan Development Network have developed a very strong partnership. It aims at defining a common framework for activities in sectors such as health, education, microfinance, or agriculture.
The center, like other institutions of AKDN, is a long-term commitment to improving the quality of life for the populations it serves.
The Heart and Cancer Center represents a critical investment in the people of this region. We hope that future generations will look back at this moment, much as we look back to earlier steps along the way, and see that the work we undertake today does indeed mark an important benchmark on the path to a happier and healthier future.